Hello everyone, welcome to Eye to Eye Gurukul. Friends, I'll be taking you through the ophthalmic trial set session for the next couple of minutes. Before going to start this my today's session, I would like to request you all please subscribe my channel and hit the bell so that you will get all the notification whenever I am uploading the new sessions on this platform. Friends, we'll begin with the topic that is the ophthalmic trial set. In this session, you will be able to describe the importance of trial set. You will be able to list the accessories available in the trial sets. You will be able to explain the importance and uses of trial lenses. And finally, you will be able to describe the care and maintenance of trial lens and trial set. Friends, just think on these images were shown on this slide. In this first image, you can see there are many different types of needles and threads are there, measuring tape is there, scissor is there, and the marker is there, and the tailors both are making the dress. So these are the materials. Can you think on this? Why I am showing these images on this slide? Okay, coming to the point that for the optometrist and ophthalmic technician or an eye care practitioner, when we do a refraction, we need a trial set. Here, the tailor requires these accessories to make an address with the shaving machine. So, like that only, we require trial set to complete the refraction for the ophthalmic patients. Moving towards the trial set, this slide gives you a purpose and uses of trial sets. A trial set contains various powers of lenses to conduct the refraction test. The trial set lens sets contains spherical lenses, both plus as well as the minus lenses, cylindrical trial lenses, again same both type, that those are minus and plus lenses. Prism lenses are there in the trial set, and accessories are also there. For example, junction cross cylinder, occluder, stenopic slits, many more. The trial lenses contains in a trial case are called trial lenses. Each lens is labeled so that the power can be identified easily. A plano lenses, opaque disc, pinhole and stenopic slit, Maddox rod, red and green glasses are also other accessories in the trial set. Moving towards the content of the trial set. We have total number of lenses in the standard trial set. Those are 254. This includes the spherical lenses in the form of plus and minus, cylindrical lenses again plus cylinder and minus cylinder, and also we have 14 prism lenses in the standard trial set. Apart from these lenses, we have accessories lenses and instruments in the trial set. Those are stenopic slit, red and green filters, Maddox rod, pinhole, occluder, trial frame, Jackson cross cylinder, IPD scale and Snellen's near vision chart. So the trial set, standards trial set contains these all accessories lenses as well as the spherical and cylindrical and prism lenses also. The number of lenses may vary depending on the company and its cost, but any standard trial lens case will hold lenses not less than these numbers. Means total 254 lenses will be there in the standard trial set. Coming to the next point, trial lenses. As I mentioned in the earlier slide, the spherical lenses those are in the 116 numbers. Spherical trial lenses are also called spares. It can be either plus or minus lenses. The sign markings on the rim and the color of the rim differentiate the plus and minus lenses. Plus lenses have plus sign on the rim and it may be black or green colored rim. Whereas minus lenses have minus sign on the rim. These are usually in the red colored rim. The power of spherical lens is measured in the diopter. Every trial set is different, but usually the plus spherical trial lenses are on the right side of the trial set. Minus spherical trial lenses are on the left side of the trial lens set. The power of the spherical trial lenses is kept between the plus 0.25 to plus 4 diopter, increasing in power in 0.25 diopter of steps. Each trial lens set has two trial lenses for every spherical and cylindrical lenses power, because sometimes the same lens power is required for both the eyes, right and left eye. Coming to the next point, that is the cylindrical trial lenses. The power of the cylindrical lens is measured in diopters cylinder. The cylindrical trial lenses are in the center between the plus and minus spherical lenses. The power of the cylindrical lenses in power between plus or minus 4 and plus or minus 6 diopter, increasing in 0.5 diopter of steps. Each trial lens set has two trial lenses for every spherical and cylindrical lens powers, because sometimes we need same lens power for both the eyes, right and left. So as I mentioned in the earlier slide, that plus or minus 0.25 to 3.75, that has 0.25 difference steps and 0.5 steps in the power range from the 4 to 6 diopter. We use these cylinder lenses to verify the astigmatism and to verify the axis. Friends, coming to the next point, that is the prism lenses. You can see the image in the slide. A prism is a triangular geometrical figure having two refracting surfaces meeting an apex joined by the base. The prisms used in the treating diplopia and overcoming the residual deviation in squint. In the trial set, prism range from 0.5 prism diopter to 12 prism diopter. The prism power of the prism lens is measured in the prism diopter, as I mentioned in the earlier. Prism lenses are available in the trial set in the center of the or near to the cylindrical lenses. Moving towards the next point, that is accessories of the trial set. In the accessories, we have stenopic slit. You can see in the image here. This consists of rectangular aperture ranging from 0.5 to 1 mm in width and up to 15 mm in length. It reduces the size of the blur circle in the meridian at the right angles to the slit, yet allow the blur circle size to be unchanged in the meridian coincident with it. Uses of these stenopic slits are to find out the astigmatic power and the axis, and to measure the vertex distance. Coming to the next point, trial lens accessories, red and green filters. So you can see in the image that glasses frame has a right eye red lens, red filter, left eye has a green filter. Red and green lenses are primarily used before an eye to interrupt fusion in the assessment of binocularity. These are used for color dissociation, to find out separation of the eyes, diplopia, and to measure the fusion and color sense of the retina. These are used for the Worth dot test, front test and stereopsis. Coming to the next accessory, that is the Maddox rod. So you can see in the image here. The Maddox rod is used to find out the presence of heterophoria or heterotropia. Very useful in vertical deviations. So the device consists of series of rods. Each rod acts as a strong plus cylinder lens. Coming to the next accessory, that is the pinhole. You can see in the image there is a small hole in the center of the lens. It reduces the peripheral rays to allow the central rays to reach the retina. It helps to differentiating the visual loss, whether it is correctable by the spectacle and other any disorders related visual loss is there. This accessory looks like an occluder, but it has a small one or two more holes in its center. It is used to conduct the pinhole test to find out whether the poor visual acuity is caused by the uncorrected refractive error or by an eye health problem. Coming to the next accessory, that is the occluder. You can see there is occluder image in the slide. So this accessory is a piece of black plastic inside a lens rim. It is used to cover the eye that is not being examined. Friends, coming to the next accessory, that is the trial frame. In day-to-day practice, we use trial frame for the refraction purpose, and we have many compartments in the trial frames. A trial frame is adjustable spectacle frame. Okay, we have an adjustment, for example, IPD, temple angle, temples, like that. And it is used to hold the trial lenses in front of the patient's eye. It is especially useful when they performing the refraction because it makes it easy to change the lenses. The axis scale is marked on the trial frame. It has markings 0 angles to the 180 angle degree. The places where the trial lenses are inserted into the trial frame are called as the lens shells. There are lens cells in front of the trial frame aperture and more lens cells at the back of the trial frame. Please note, it is better to place high powered spherical lenses in the back lens cells for the trial frame. The spherical lenses are placed close to the eye. Lenses that are placed in front of the cells can be rotated. This is useful because cylindrical lenses need to be rotated during the refraction to determine the amount of the axis of the person's astigmatism. It also allows the axis of the cylindrical lens to be accurately placed against the axis scale marked on the trial frame. So you can see in the image the situated lens on the eye, spherical lenses, middle we have a second compartment that is the cylindrical lenses. Further from the eye, that is the prism or a Maddox rod you can place on that compartment. Now we'll see what are the trial frame adjustments are there. In the trial frame, as I mentioned in the earlier slide, that we have IPD adjustment, nose pad adjustment, temple angle and temple adjustment. We'll see one by one. The first one will go through the temple or an earpiece, the side of the arm of the trial frame. They can be adjusted longer or shorter so that the frame fits firmly at the right distance from the person's eye. Second one is nose pad. This sits on the top of the patient's nose. It can be made higher or lower so that the eyes of the patients are in the center of the trial frame. Next point, that is the temple angle or an angle, it is adjusted so that the trial frame aperture sit vertically on the patient's face. The last one, interpupillary distance, or you can say PD, this moves the trial frame aperture closer or further away from each other. They should be adjusted to the person's PD so that their eyes are in the center of the trial frame aperture. So we have in this trial frame the placement of lenses. As I mentioned in the earlier also, strongest spare, as I said, in the cell 1, that is the back wall of the trial frame. Cylindrical lenses most posterior of the anterior wall, that is the second one, and auxiliary or an lenses or an accessory lenses, prisms, additional lenses, additional power, spherical power, cylindrical or an occluder, that can be placed on the third cell. Now we'll discuss about the Jackson cross cylinder. Jackson cross cylinder or an JCC is a special accessory lens with a long handle than the other trial lenses. It has several lines on the markings on the lenses. This Jackson cross cylinder is a spherocylindrical lens. The power of the cylinder is twice of the power of the sphere and of the opposite sign. It is used to refine the power and axis of the cylindrical power. Now we'll see IPD scale and pupillometer. You can see in the image that the right side image is showing this PD scale and the left side image is pupillometer. So this is used to measure the uniocular or binocular interpupillary distance. Before you put the trial frame on a person or a patient, please measure the patient's PD using a scale or a pupillometer for the interpupillary distance measurement. Now we'll discuss about the Snellen's near vision chart. So you can see in the image, when the trial frame is used for near vision test, the Snellen's near vision chart is handed over to the patient, and from a reading distance of 33 centimeter, the patient will read the smallest letter. The lens for reading the chart is placed in the trial frame and balanced for the both eyes. Coming to the small activity here, we have seen all the contents of the trial set. So you can circle the odd one out. So in this, as I mentioned here in the earlier slides, that we have a spherical lenses in the trial set, stenophix slit is then accessories, cylindrical lenses are there, autorefractometer is not there. So, and scissor is also not there in the trial set. Ophthalmoscope is not there in the trial set. The tonometer is also not in the trial set. So pinhole is there, prisms are there, IPD scale will be there, red and green lenses or and filters are there, Maddox rod is there. So in this you can mark here, tonometer is not there as an activity, you can mark here as a autorefractometer, ophthalmoscope, scissors are not available in the trial set. These are the odd names in the trial lenses or an accessories of the trial set. Okay, so now we'll move towards the cleaning and maintenance of this trial set. Friends, please note the following guidelines. Clean your all refractive or an refraction equipment using spirit or an cooling. So do not clean the IPD scales with the spirit, as it may erase measurements on these scales. Use a lens cloth to clean the lens and avoid rotating the lenses while cleaning the to prevent the changes in the axis, specifically in the cylindrical lenses. Please remember to change the batteries in the torchlight after finishing the work. So these are the important points to be considered. During the maintenance, the trial frame is wiped with the soft cloth to keep it free from the dust and should be wiped between the patients. The trial lenses can be cleaned with the glass cleaner or a soft cloth. Okay, as I mentioned in the this slide, spirit or choline you can use. Keep the lenses in this case after the using. So these are the important points to be considered to maintain the cleaning of trial lens as well as the accessories lenses. During the refraction procedure, use the hand grip to pick up the spare and cylindrical lenses to avoid scratching them. Turn off the strip before switching off the switchboard to prevent the bulb from the fusing. Handle the equipment carefully to avoid dropping it. Switch off the charger immediately when it reaches 100% to prevent the damage. Care should be taken not to drop the trial frame, trial lenses, any other instruments in the clinic. Okay, the frame can be go out of alignment if dropped. The trial lenses should be kept in a case to help keep them clean. These are the important points to be considered for your day-to-day practice. Coming to the identifying the equipments, those are used in the refraction unit. You can see in the image which type of lenses are these? These are spherical lenses. What about this? This is the retinoscope, strict retinoscope. Okay, and this one you know better. So this is the torch we use in the refraction unit to check the ocular structure and at an exam. And the next one is the Maddox rod. We use this one for to find out the heterophoria or heterotrophia. And the second last is these are the cylindrical lenses. You can see there are markings on the lenses. Those indicates the axis meridian. Perpendicular to the axis meridian there is a power meridian. So in the axis marking meridian there is no power. Perpendicular to this axis marking there is a power. So these are the cylindrical lenses. And then finally we have a pinhole which is used to check the poor vision status, whether it is because of the uncorrected refractive error or any ocular conditions that can cause the visual loss. Coming to the end of this session, we will see mind map of this program. So initially we discussed about the trial set and trial lenses and prisms, and then we discussed about the trial frame adjustment, Jackson cross cylinder and its uses, and PD ruler and near vision chart, and finally we discussed cleaning and handling of these trial sets. Friends, I would like to thank you all for your patient listening, and please remember to subscribe my channel and hit the bell so that you will get all the time notifications whenever I am uploading the new sessions on this platform. Thank you.